As Dr. Shah mentioned, case counts have risen at really unprecedented rates in recent weeks, and our genomic sequencing data indicate that probably more than 80% of recent infections are likely due to the Omicron variant. Next slide. And so while Omicron has been able to evade immunity from vaccination better than Delta, vaccination is still so important. So as you can see in this graph, vaccinated populations shown in the green and yellow lines have seen a steep rise in cases, but rates in unvaccinated populations shown in the red line has been 3 times higher. So while vaccination is somewhat less effective against Omicron than it was against Delta, it is still so important because it greatly decreases your chance of infection. Next slide, please. Fortunately, we have not seen a rise in deaths, although it's important to keep in mind that changes in death rates can follow changes in case count, sometimes by more than a month. So this is something that we'll be following closely over the next several weeks. Next slide. And again, vaccination is the best way to protect against death from COVID-19. So as this slide illustrates, rates of death in those 65 years and older are 15 times higher than in the unvaccinated population than in those who are vaccinated. And so decreasing hospitalization and death is why all of us need to get vaccinated and boosted. And so this graph shows that, as Dr. Shah mentioned, we are seeing a steep rise in hospitalizations in recent weeks. And we are hearing from many hospitals, especially those in Western Washington, that their capacity is becoming critically strained from a variety of factors, including staffing shortages exacerbated by Omicron infections and the need for isolation and quarantine. And strain on our hospital system is so important because it impacts care not only for those with COVID-19, but also those needing hospital care for other reasons such as heart disease, lung disease, and cancer. So again, getting vaccinated and boosted is the best way to protect yourself and the best way to stay out of the hospital for COVID-19 as it decreases your risk of hospitalization, as this slide shows, by more than 10 times. Unvaccinated individuals have rates of hospitalization, unvaccinated individuals 65 years and older have rates of hospitalization 13 times higher than those who are vaccinated. So our healthcare workers in clinics and hospitals who have done so much for our communities are exhausted and understaffed. And so it's so important for us to do everything that we can to support them. So as Dr. Shah said, don't go to the emergency department unless it's an emergency. If you are sick and having mild symptoms, isolate and care for yourself at home, as Dr. Shah mentioned. And finally, protect yourself from COVID-19 infection through masking, social distancing, and most important, getting vaccinated and boosted.